Hi guys!
Hi guys!
Hey guys!
Hi guys! I'm Jonah.
I am Paula.
I'm Geraldine.
I'm Dana.
We are Group A Caregiver students.
Hi future nurses! So for today's video, we are going to tackle about the nursing process. So what are we waiting for? Let's get started. Well, before anything else, let us know what is a nursing process is. So a nursing process is just a step-by-step system for what exactly you will do as a nurse. Or in other words, it is a systematic, rational method of planning and providing individualized nursing care. The nursing process is an action-oriented, client-centered, and outcome-directed. Its purpose are to identify a client's health status or potential healthcare problems. And now, let's talk about each of its phases in the nursing process. What they are and what you'll need to do in each phase. In nursing process, we have this called ADPI. A stands for assessment, D stands for diagnosis, P for planning, I for implementation, and E for evaluation. So let's walk through each of these phases in the nursing process. The first phase is the A in the ADPI, which is the assessment. Assessment is the first and most important thing you will do as a nurse. In assessment, the registered nurse is responsible in collecting, organizing, validating, and documenting the data of a patient. An example of assessment is where you as a nurse take vital signs of a patient. In assessment, there are 4 types of it, which are the initial assessment, problem-focused assessment, next is the emergency assessment, and lastly is the time-lapse reassessment. The first is initial assessment. It is performed within a specified time after admission to a health agency. Its purpose is to establish a complete database for problems identification. Second is the problem-focused assessment. It is performed during ongoing process integrated with nursing care. Its purpose is to determine the status of a specific problems identified in an earlier assessment. Next is emergency assessment. It is performed during any physiological or psychological crisis of the patient. Its purpose is to identify life-threatening problems and also to identify overlooked and new problems. Lastly is the time-lapse reassessment. It is performed several months after the initial assessment. Its purpose is to compare the client's current status to baseline data that was previously obtained. Assessment has 2 main components. First is collecting data, where you as a nurse take vital signs, getting the patient's history, asking them questions about their lifestyle, or even performing a head-to-toe assessment or a focused nursing assessment. There are 2 types of data. Either it is subjective or objective data. Subjective data is what has been verbalized by your patient, while objective data comes from what you observe from your patient. The second one is the critical thinking. This is when you are constantly thinking about what could be going on with your patient and what you need to assist for further. You as a nurse notice some slight changes with the patient condition and how they respond to questions.
So now guys, let's talk about the second phase of the nursing process, which is the diagnosis. In this phase, nurses use critical thinking skills to interpret assessment data and identify client strengths and problems. In diagnosis, nurses will analyze data, identify health problems, risks and strengths, and also formulate diagnostic statements. Diagnosis is a pivotal step in the nursing process. There are 4 stages of the nursing diagnosis, which are the actual diagnosis, second is the health promotion diagnosis, third is the risk diagnosis, and lastly is syndrome diagnosis. First is the actual diagnosis. It is the present client problems based on the presence of associated signs and symptoms. Second is the health promotion diagnosis. It relates to clients' preparedness to implement behaviors to improve their health condition. Next is the risk nursing diagnosis. It is a clinical judgment that a problem does not exist, but the presence of the risk factors indicates that a problem is likely to develop unless nurses intervene. Lastly is the syndrome diagnosis. It is assigned by a nurse's clinical judgment to describe a cluster of nursing diagnoses that have similar interventions. For example, a nursing diagnosis is not a medical diagnosis, such as asthma. Your patient with asthma is really restless, nervous, or anxious. The nursing diagnosis could be something like anxiety, because that is the patient response to their asthma. And now, let's walk through the letter P in the ADVI, which is the planning. It is a deliberative, systematic phase of the nursing process that involves decision-making and problem-solving. In planning, the nurse refers to the client's assessment data and diagnostic statements for direction in formulating client goals and desired in the nursing interventions required to prevent, reduce, or eliminate the client's health problems. Planning also prioritizes problems or diagnoses, formulate goals or desired outcomes, select nursing intervention, and write nursing interventions. There are three types of planning. It is the initial planning, ongoing planning, and discharge planning. Initial planning is performed by the nurse in admission assessment and should be done as soon as possible. Ongoing planning is done by all nurses who work with the client. It occurs at the beginning of a shift as a nurse plans the care to be given that day. Lastly is the discharge planning. It is the process of anticipating and planning for needs after discharge.
The fourth step of the nursing process is implementation. It is an action phase which the nurse performs a nursing intervention. It consists of doing and documenting the activities that are a specific nursing action needed to carry out the intervention. And implementation, it includes the reassessing the client, determining the nurse's needs for assistance, implementing the nursing intervention, supervising the delegate care, and documenting the nursing activities. There are three types of implementation. First is independent, next is dependent, and lastly is the collaborative implementation. Independent nursing intervention is just like, for example, when a nurse will monitor the vital signs of the patient, discuss the restriction of the salt intake and correct exchange if used, and encourage the patient to eat only at a table or designated eating place and to avoid standing while eating. Next is dependent nursing intervention. It formulates an eating plan with the patient using knowledge of individual patterns of eating, energy, and nutrient requirements. And lastly is the collaborative nursing intervention. This kind of implementation will consult a dietitian to determine the caloric and nutrients requirements for the individual weight loss. And that's all for implementation.
Walk through to the last and final step of nursing process, which is evaluation. Evaluation is continuous and done while or immediately after implementing a nursing order that enables the nurse to make on-the-spot modifications in an intervention. In evaluation, nurses do collecting data related to desired outcomes, comparing data with desired outcomes, relating nursing activities to outcomes, drawing conclusions about problem status, and continuing, modifying, or terminating the nursing care plan. In this phase, the nurse determines the client's progress towards goal, achievement, and the effectiveness of the nursing care plan. In evaluation, you as a nurse will just evaluate the patient if they met their goals or not, and what needs to be changed in order to help them meet their goals. That's all for evaluation.
And that's the nursing process and its phases. Hope you learned something meaningful from our discussion. Just put it in your mind that we as a nurse will always give them hope because we are an angel with a stethoscope. God bless future nurses.